recent shooting at the CDC is a stark reminder of the urgent need for change in our treatment of public health professionals. On a grim Friday afternoon at around 4:50 p.m., tragedy struck at the Atlanta headquarters of the Centers for Disease Control and Prevention, CDC, when a gunman opened fire, resulting in numerous bullet marks across office windows and the heartbreaking death of DeKalb County Police Officer David Rose. Law enforcement officials suspect that Patrick Joseph White, the shooter, acted out of anti-vaccine fervor, laying blame on the CDC for personal health complications he associates with the COVID-19 vaccine. Although many details remain unclear, one undeniable truth emerges. This devastating incident is not merely an isolated case, but rather a symptom of the escalating dangers faced by public health workers in an environment increasingly defined by misinformation, political strife, and heated language. Adding to the unsettling nature of this situation, it took Health and Human Services Secretary Robert F. Kennedy Jr. over 18 hours to release a public statement denouncing this brutal act. During that gap, I spoke with CDC staff members who felt utterly abandoned by the very leaders meant to safeguard them. Individuals understandably demoralized by budget cuts and staffing challenges imposed by the current administration. Effective leadership is crucial, especially in times of crisis. Kennedy's delayed and lukewarm condemnation, coupled with his track record of provocative and polarizing statements, has only intensified trauma and fostered a sense of betrayal among the dedicated public health workforce. In my experience as a former U.S. Surgeon General, I have witnessed the fragility of trust in public health systems. Recently, Kennedy attracted attention for his announcement regarding the cessation of funding for mRNA vaccine research, making unfounded claims about the inherent dangers of these vaccines. Such misleading statements not only jeopardize public safety, but also undermine the credibility of decades of precise scientific research. When influential figures choose to disregard established facts, they weaken public faith and empower those who view health professionals as foes rather than allies. The shooting at the CDC is part of a deeply concerning pattern. In February 2025, a similar act occurred at UPMC Memorial Hospital in York, Pennsylvania, where a shooting resulted in the death of another police officer and injuries to healthcare workers. Reports from the American Nurses Association reveal a shocking statistic. 1 in every 4 nurses faces violence in the workplace. Alarmingly, this rate exceeds that seen in law enforcement or correctional facilities. Furthermore, just a year prior, United Healthcare CEO Brian Thompson was killed, following a wave of online backlash that disturbingly framed the situation as justified outrage against the healthcare system. What connects these tragic occurrences is not simply the violence itself, but the hostile context that fuels it. Over time, influential voices, Kennedy and his supporters among them, have characterized health professionals as deceitful, harmful, or even malevolent. These individuals have been labeled with derogatory terms such as grifters and enemies of the people. A particularly disheartening remark came from Vinay Prasad, a senior FDA official selected by Kennedy, who, upon being asked if Americans should forgive public health figures for their missteps, responded, "I don't believe in forgiveness, because in my opinion, these pieces of shit are still lying." This kind of acrimonious language from a high-ranking public servant does not merely convey frustration. It fosters a dangerous climate of dehumanization that could potentially result in real-world violence. This hostile atmosphere has been steadily growing, particularly regarding vaccines and responses to COVID-19. The unfortunate measles outbreak in Samoa in 2019 serves as a key illustration. 83 lives were lost, most being young children, after vaccination rates plummeted. RFK Jr.'s involvement and rhetoric at that time received widespread condemnation, with Samoa's top health official labeling his claims that the deaths were unrelated to measles as a complete lie. His influence undeniably worsened a situation already vulnerable to misinformation. When prominent figures spread falsehoods, they validate the anger that can lead to violence. Public health professionals, ranging from CDC researchers to local health officials, are increasingly subjected to harassment, threats, and now even gunfire for simply performing their necessary duties. This situation is outrageous, and the administration's response has been belated and insufficiently forceful. Thus far, there has been a conspicuous lack of effort to address the harmful rhetoric that contributes to these acts. So, what immediate actions must we prioritize? 1. Leadership needs to take a firm stand. The administration should categorically denounce any language that maligns public health professionals. Building public trust begins with leaders who advocate for the importance of science-driven health initiatives and the individuals that uphold them. 2. Eliminate scapegoating. Current leaders should refrain from redirecting public frustration regarding systemic health issues toward the dedicated professionals trying to manage them. Such demonization of doctors, scientists, and public health organizations incites violence and derails potential solutions. 3. Ensure the safety of healthcare workers. It is imperative for Congress to swiftly enact the Workplace Violence Prevention for Healthcare and Social Service Workers Act, mandatory for creating comprehensive violence prevention strategies within healthcare settings, inclusive of improved training, tracking incidents, and increased protections for employees. 4. Invest in solutions rather than slogans. While former Surgeon General Vivek Murthy declared gun violence a public health emergency, citing over 48,000 gun-related deaths in 2022, the numbers speak volumes, along with the rising targeted attacks on health institutions. We need real funding for research and preventative measures, not just more good guys with guns or empty thoughts and prayers. Public health workers are not adversaries. Rather, they are our friends, caregivers, scientists, and the first responders in any health crisis. The recent shooting at the CDC should serve as a crucial wake-up call, not only for policymakers, but for society as a whole. It is time to reject the damaging language that strips the humanity from those striving to keep us safe, and initiate concrete measures to protect them. Let us honor Officer Rose, along with every public health professional currently facing these increasing dangers, not merely through words, but through decisive actions taken swiftly, before another tragedy occurs.